Tell me, Steve, how did your pain start?
Approximately 15 months ago, I developed a pain down my right side and groin area. I went to my GP and they initially thought that I had kidney stones. So they sent me for a CT scan, which was clear.
So you've been to the hospital a few times for your pain. What did they do at the hospital and what investigations have you had?
Yes, I ended up having approximately 3 trips to A&E over approximately a 3 or 4 month period. Just developing severe pain. For one of the visits, they thought I had a twisted testicle, but that proved to be not the case, and put me through numerous tests with urologists. I had CT scans, MRI scans, but still no result.
What did you feel when there were no answers?
Probably got a little bit demoralised, a little bit down because the pain was still continuing, and it was the last visit that I actually had to the hospital. I got told that there are some situations and conditions that can't be diagnosed, and they've done all the investigations that they could, and I would have to basically control and manage it to the best of my ability, and that's how it was left. So that was the answer that I had to put up with and accept.
Describe the suffering. And did you feel it was endless?
Yes, I did. I mean, when you get to a stage where it's been continuing for such a reasonably long period of time, you know, you would hope that there would be an answer to the problem, but you know, it's when you've seen specialists and surgeons and they've told you they can't discover the problem, you've kind of got just to accept it.
What about medications?
After the initial 2 or 3 trips to A&E, I was given some painkillers to take initially, but after that I felt that I was just going to manage it myself. I didn't want to stay on painkillers continually, so I just managed it to the best of my ability at that stage.
What prompted you to seek further help?
So I went back to see my GP, and he referred me to Dr Kanji, a skeletal specialist who thought he may be able to help me. Dr Kanji had received all my CT scans and MRI scans, and prompted to put them up on his screen, and within probably 10 minutes showed me where he thought the problem was arising from.
I talked to Stephen, took a story about how his pain was created, as well as examined Stephen, and I had an idea that it was probably his back. To check the diagnosis, I checked his old x-rays, and there was a kidney scan that showed his back. And in the kidney scan, we can see that the disc here is narrowed compared to this disc above. Now the discs in the back are designed to absorb pressure, and so that the bones don't get pressure. Once the bones get pressure, electrical signals travel to the brain and can create pain.
Within probably 10 minutes, showed me where he thought the problem was arising from.
Once he knew what was wrong, he was able to reduce the pressure on his back, as well as have treatment to stretch his back and his muscles.
He gave me a recommendation that we do some deep massage therapy on my side and glutes, and within 6 to 7 treatments with a deep massage therapist, the pain had predominantly gone away.
This caused almost total resolution for Stephen over 3 weeks.
After those 6 to 7 massage treatments. I've had no pain at all in the last 2 to 3 months. At all.
Was it hard to believe that you finally found the answers?
Well, yes, it was really, because over the previous, like I say, 12 to 15 months, the hospital and surgeons and neurologists hadn't been able to identify where the issue was arising from. And here I am within 10 minutes of sitting in Dr Kanji's surgery, being told within 10 minutes that he could see where the problem was straight away. So, yes, I was a little bit upset, to say the least, that I'd been over a lengthy period of time in discomfort, and within 10 minutes it had been resolved.